Good morning, everyone. This is Yelena Resnick, physical therapist. If you follow me, you know me. If you don't, I am a physical therapist with my own private practice that I run for 20 years now. Today, I would like to speak about additional services that I do. I am a cognitive behavioral therapy coach. I'm certified in cognitive behavioral therapy, and I work with people remotely, people who suffers from anxiety, depression, irritable bowel syndrome, and all other emotional distresses. I'm not a psychologist nor psychiatrist. I do not diagnose. I don't prescribe any medications, but I do therapy sessions using HIPAA compliant platform where I work with people with different conditions, usually sessions about half hour, and I charge fixed rate for that. Pretty reasonable, and it can be done at the luxury of your own home. You don't need to go anywhere. And let's go over what's cognitive behavioral therapy. A lot of people heard about it, but sometimes people don't know what is it about. Um, Let me try to explain it in simple words. It's basically when you change your cognition, resulting in the positive behavior and positive physiological response. As you know, we are completely depend on our mind, our brain, and our physical feelings and conditions are directly related to our thoughts generated by the brain. I don't know, unfortunately, brain is also an organ. You have to understand that can get out of shape. Let's put it this way. It can be overexhausted. It can have uh, chemical disbalance that resulting in the emotions that you don't like. I'm gonna go over some very common conditions that I work with, and I can say I'm successful because people are reaching out to me. um, let's put it this way. Brain cannot see, so once it develops this thought, it will give you certain physiological response. To understand that better, let's think about you watching the horror movie. You understand that this is the movie. It's not the reality. There's no monsters behind you. There's no demons haunting you. But your brain cannot really identify whether it's reality or not. So once it perceives the danger, it gives you what it's called parasympathetic response, when you might have sweaty palms, you might have some you know, stomach upset. You feel like you need to go frequently because your adrenal glands are working like crazy, releasing all the hormones that makes you go. So you are basically getting a physiological response, but it doesn't mean that whatever is happening on the TV is the reality. So I'm hoping you understand how it works. So that's why it's called cognitive behavioral therapy. Because what I do, I train your cognition not to uh, respond inadequately or disproportionately to your thoughts, therefore easing the physiological response that you would have. Let's go through the examples. Let's go through the recent one. I work with someone who had extreme feeling of guilt because the kid didn't um, met did not meet the expectation of a person. Let's say if you expect a kid to go to college and kid doesn't go to college, drop out and all that. And then the parent would, not would, but this specific parent developed extreme feeling of guilt. And basically it was easy fix for me, at least. We were able to fix it over one session. Because unfortunately, we confuse our feelings sometimes. We confuse depression with being sad, just sad, because people label themselves with the diagnosis of depression, not knowing what really clinical depression is, when they just sad. And that's normal to have days off sometimes, being sad for a couple of days, because we humans, we have emotions. Something hurt us, so we sad about it, but it doesn't mean that we're depressed. So in this situation, some people confuse feeling of guilt with just being sorry for another human being. So let's put it this way, and I'm sure that she's not the one. I'm sure that there's parents that watching this video who, let's put it this way, upset with the situation, with the kids, whether they, not going to college or dropping out of college or not listening and all that. So let me give you my view of it. As a parent, you are liable to take care of your kid at least until 21 or 18, at least 18. So if you provide food, you provide proper education, clothing, living conditions, some entertainment, you fulfill your obligation as a parent. And there should not be feeling of guilt. So sometimes this feeling is get confused with just being sorry for another person. In this situation, that would be your kid, your brother, your mother, somebody else. So basically, you are sorry for that person not going to college. You are sorry to see that that person is not living the life that you expected for that person to live. You are sorry that your dreams did not come true, because we all have our dreams regarding our kids, and if it doesn't go our way, we upset. So it was pretty easy fix once the cognition of that person got to the point of understanding that the feeling is not guilt. This is feeling of being sorry for another person. Let's say if you see a homeless person, you're going to feel sorry, but it's not guilt. You didn't do anything for that person to be homeless. If you see a sick person in a hospital or on TV, you feel sorry, but it's not guilt, because you did not do anything to affect that person. Same thing if you see your loved ones or close relatives not doing what you perceive would be better for them, you just feel sorry for that. This is not feeling of guilt. Feeling of guilt comes when you don't fulfill your obligation as parent. Such as you don't send your kids to school, you don't come to school conferences, you ignore the teachers, you don't provide the good quality food, clothing, living environment. That would result in feeling of guilt, yes. But again, don't confuse those two. So that was just one example. I've been working also very successfully with people having irritable bowel syndrome, because believe it or not, a lot of people see gastroenterologists, take like, I don't know, unlimited amount of vitamins to restore the irritable bowel syndrome. But in many instances, of course, there is also pathological conditions such as bacteria and something else that could lead to that. But in some conditions, it can be psychological component in it, mainly anxiety, because we respond an interesting way to anxiety. Again, because your brain doesn't have eyes and your brain cannot identify whether the situation is real or not. So it's just giving you fight or flight response. So we as a cognitive behavioral coaches, we kind of help people to build the cognition differently, so the symptoms become easy first and then hopefully disappear completely. So basically, you just have to change your cognition to get rid of the symptoms. So some people respond to anxiety by having a palpitation, so having cardiovascular symptoms such as, again, raised heart rate, running heart rate, that's how they call it. They would have sweaty palms. Some people sweat a lot. Some people have poor control over the speech because they become speechless if they have severe anxiety. They can't think straight. But in some people, it causes gastrointestinal upset. So anxiety triggers different symptoms differently. It can trigger a cardiovascular system by raising your blood pressure, by giving you increased heart rate. It can trigger your limbic system when you sweat a lot. It can trigger your gastrointestinal symptom where you would have a massive diarrhea. So that can be corrected with cognitive behavioral therapy. I don't even have anything else on top of my mind to give you as an example right now, but I work with a large variety of conditions. But I can't help everybody, of course. If I can't help, I just usually say it that I cannot help. There is one fee for each session. I don't charge more for evaluation because from my experience, it's almost impossible to evaluate somebody in one session because sometimes people open up after they see me 2-3 times and then I see the real core, and can dig out the problem and we can work on that problem. So sometimes it takes more than one session. So let me tell you how it goes with me. Usually we schedule one session a week, sometimes twice a week, depending on the severity of condition. And then I would do it for maybe once a week for about 3 months. And then I would cut it to once in 2 weeks. And then I would cut it to once a month, once in 2 months, 3, and then eventually you graduate. I want to make sure before I let people go, I want to make sure that they're okay. You have to keep in mind that sometimes I get clients who do come back to me because, again, they get themselves exhausted. They forget the training. We tend to forget stuff, and which is okay too. There's nothing upsetting in that. Again, the brain is the organ. Let's say we get the flu, we go to the doctor. The next year we get the flu again, we go to the doctor again. And there's nothing wrong in it, nothing upsetting in it. The brain is the same way. You feel like you need some help, you come and see me. You don't come, it's all remote, it's virtual. You have a session with me. If you feel like you still need more sessions with me, you need to come back, you come back. So just look at it as having a flu. That you don't go crazy, please. Don't think about you going crazy. The first thing I tell to my clients when I start working with them, that they are not crazy, because people, if they don't understand what's going on with them, they go nuts. So calm down. You're not crazy. My contact, you can contact me at my number. I'm going to give you my office phone. And once you call my clinic, you tell them that you are calling regarding cognitive behavioral therapy coaching, and I will give you a call. My it just my permanent clients, they do have my cell, but I don't like to share it on social media, so I'm going to give you my office number. If you need therapy, you just call that number and tell the receptionist that you need cognitive behavioral therapy coaching. So when you're ready, okay, call my private practice number. The number is 347-425-9044. I'm going to leave the number in the comments in case if you didn't get a chance to write it down. So if you do need my services, give me a call, leave a message with a secretary on the phone, and I will give you a call back. There's no guarantee that you're going to get a session right away, because I have another job and I do counseling on the days that I have availability. I have to put you on the program, so don't expect start the session next day. So if you do need that, please call as soon as you can, so I can put you on the program and hook you with my software. Again, it's a HIPAA compliant. It's medical software that I use to run my sessions. All right, everybody, have a wonderful day and take care of your mental health. So I'm not only a physical therapist, I'm also a counselor who takes care not only the physical body, but also mental health. All right, have a good day, everybody. Bye-bye.